Hi, everyone. It's Dr. Arlene Diamco, the MultiDimensional MD. Thank you so much for joining me again for another episode. And today I have Dr. Heidi Molga here, and she has been interning with me. She's a resident for osteopathy. And we have so many things that we would like to share with you. And as you know, part of my mission is to bring the intuitive aspects of health back to medicine in practical and tangible ways so that we can access deeper healing and experience more peace, love, and joy in our everyday lives. That word practical is so meaningful because how do we make these things that feel intangible, like the mental, emotional, spiritual aspects, and how do we integrate that into health? And how can we make our treatments more efficient? How can we access deeper healing? And so we're here to talk to you, both medical community and patients and anyone looking to just be able to see things from a bigger perspective so that they can access more healing within themselves. So welcome, Heidi.
Thank you so much for having me. This is so fun.
Yeah, so Heidi and I met at an introductory course in cranial osteopathy a few years ago, and we got along really well. And we found that we have a lot in common in terms of our perspectives on health and looking at the whole person, the whole being, not just the physical. And we've had a lot of conversations and we've seen a lot over the last week. And we thought that we would share some of those stories with you.
Yeah, I would love to share some of the stories. It's really been a mind-blowing week this week. So I'm really grateful to be here.
I mean, even before you got here, I know you had gotten my book and you had done some reading.
Yeah.
And you'd started implementing some things from the cranial course. But like, what were some of those moments for you? Like, what were moments where you're like, oh my gosh, like this is incredible? And what did you see for your patients? And what did you see for yourself?
Wow. Okay. Such a loaded question. I think that I got a little bit from our work together in the cranial course because we did have a full day together. So, but that just felt like a very, we were just scratching the surface because
the tip of the iceberg.
Exactly. And we were within the confines of a course that was already predetermined of what was going to get taught. And so there's a lot more to be found within this and within just working with you personally. Like, you do such a good job conveying the way that you sense in this book. And so after I started reading this, I was like, this is it. Like, this is exactly how I want to be practicing and what I believe and how I want to approach people. So I started just kind of dabbling with it with like consenting friends and things like that, and had some really, really profound, like, some of these people had really profound reactions to just looking at them in this like multi-dimensional way. Like, if it's okay, I'll share a story with
absolutely.
you. I was away on a retreat during like a week off in my residency and just working with like one of my friends who had admitted to me that they could never lift their arms over their head since they were a little kid, like really little, like 7. And we didn't really get into, the story of what happened. A lot of times to me, the story isn't important. So I'm not going to like dig and ask for it. Typically, if it needs to be spoken, I find that it will arise organically anyway in the context of a treatment. So I don't like pry and pull all these things out. All I needed to know was that they felt like they had crepitus or the sound of like Rice Krispie treats when they would lift their arms above 90 degrees. And that way, when they would get massages or body work, it would go away for a little bit of time, but it would always come back. Usually what that tells me is that there's some attachment to story that is keeping a pattern in place. And so all I did, because I saw they had this like beautiful necklace on that had 444 on it. And I am always looking for like little angel signs and little angel numbers as like a way of being communicated with in the world. And I just saw them as this angel with like little caged wings, and just during the treatment, like visualize their angel wings open. And of course my hands were moving and I was like doing techniques, like working on the fascia of the mediastinum within the thoracic compartment. So like working on their lungs, like helping their lungs expand more fully, feeling that tissue moving, and like feeling the way that their shoulder blades were moving with respect to each other. And
their wings.
Right. And so like during the treatment, I just had my hands on them, and I just got this sense like, okay, they're ready. And so I just picked her arms up and like gently moved them in all dimensions, and nothing made any sound. And I was like, okay, I think you're good. Do you want to test out your wings now? And this person was like, what do you mean I'm good? Like, you didn't really do anything. I was like, just stand up and try and fly. Like, try to fly your wings. And they just like opened their arms up and lifted them overhead. And they were just like, and lit up. And then they spent the rest of the night like showing every single person in the entire room, like 30 different people, like, look at my wings, look at how I can fly. And it stayed. Like it stayed for weeks. Like I haven't checked in with them, but last I checked in with them, they still were moving their little angel wings without crepitus. And one of the biggest things that came through during that treatment, it was just a single phrase. And it was like, you're free now, fly. And that was it. And I was like, just keep telling yourself that you're free and fly your wings every day.
That's amazing. That's amazing. I mean, when you first like told me that story, I was just like, oh my gosh.
Yeah, I literally had
like
to text her when it happened. Like I texted her while I was like, you won't believe this. I just read your book and it works.
I was just like beaming, like, you know, it's like when your kids do something incredible for the first time. And then I was like, oh my gosh, she did it. But the thing is, it's like, I didn't like show you how to do it. You did it through the words in the book, and you were able to feel it out, which is exactly why I wrote this book, I Am Intuitive, a multidimensional guide to embrace your inner light, so that people could have a DIY way of approaching things and doing it for themselves. And you incorporated it into an osteopathic treatment, which is so incredible. And I mean, there's so many ways to talk about this. And when you're talking about wings, they're symbolic. There's that kind of metaphorical wings of what it feels like to be free. And then there's the actual wings, like your shoulders, your scapula, and the structural part of that. But for them all to come together, this is this multidimensional approach that I keep talking about. It's not just the physical, but it's also how you feel, what you've been through, how you're processing that, and to be able to feel free. And I love that she shared it with so many people like that. It meant so much to her.
She like let me stay at her house for free in Hawaii after that. Like she was like, come stay over. Like I need to feed you and like take care of you, because share this with people, because why not? We're supposed to share our gifts.
I love that. Was there anything else that stood out that even before you came here that you felt like, I guess, preparing you as a physician, as an osteopath to be able to help people in a much more expanded way?
We have a teaching component to our residency where we're teaching the first and second years the basics of osteopathic manual medicine. I get to lead like a little meditation centering exercise at the beginning of class to kind of help them come into that space and into their bodies, because med students are so up here all of the time. We're like so in our brains and constantly thinking, that it's like such a blessing to get to have that moment of grounding. And I read them like in 3 different weeks, the meditation that you have in here about connecting to your like earth into the sky, and connecting to like all the other people in your life, and then connecting to all of the people that have come before you and that will come after you. And to feel that stillness within the whole room when we like sensed all of that, it's really beautiful. So your work is trickling in wherever I can fit it in.
Oh gosh. Okay, I have lots of questions for you, but I want to back up, and we got a sneak peek of like, wow, how you're using all of these things. But what got you to be interested in medicine in the first place, and what led you to osteopathy?
Well, I guess my original interest in medicine, I was like 0. Like I pretty much was born wanting to be a doctor. When my mom got pregnant with my first brother, I remember I asked her for like an anatomy book, like an OB-GYN anatomy book. And I would like look through everything, and I was like tracking where he was developing with the textbook, and she would like read it to me at nighttime and stuff like that. And I was kind of like learning to read a little bit during that window as well. I was 3.
Okay, so you were born.
Yeah, I was really little. And so like that was, I have this like weird feeling that like I used to deliver babies in a past life or something, because I'm so drawn to like mommies and babies, and like that's my favorite. The mommy baby dyad is like my favorite patient population to work on. They're the most in alignment with my style of sensing. Like my sensing is very fluid. It's very like flowy, and they're just the most liquid of all humans.
Oh, well, mom and baby are
Yeah.
are really one unit. Of
Yes.
course, you know, when you're pregnant with a baby, you really are one.
Yeah.
But then once the baby is born and you have to feed the baby and tend to that baby, you're still like really much a unit.
Yeah.
And then as the baby grows, infant, toddlerhood, little kid stage, like I usually, when I talk to people, it's like 0 to age 7. It's like this slowly growing independence, not like they're completely independent by age 7, but they have more of their sense of self.
Mhm.
But even like, you know, as families grow, you're always connected in that way. But in that beginning time, it's such a close unit.
Oh my gosh. It's like
not separate at all.
It's not separate.
Yeah.
Yeah.
What mom feels, baby
exactly.
feels. What baby feels, mom feels. And you don't have to even necessarily know exactly like, was it from mom? Was it from baby? Because it's always one.
Yeah, it literally doesn't matter where it comes from. Like as long as you treat it out of one of them, like both will typically resolve. It's super beautiful. So yeah, I just felt really drawn to that. And I think that led me to like my questioning so early on about, you know, this like beautiful life that was growing inside my own mom. And then
so this was a calling then.
Yeah,
because,
for sure.
I mean, if 3 years old and you're asking for an anatomy book, this is,
and I had like
this
anatomy
is what
coloring
you're born
books.
to do.
It was actually comical getting to medical school because I hadn't remembered that I had this when I was a little kid until I got to medical school. And then I saw these like anatomy coloring books that they had to learn anatomy. And I was like, I had these when I was 3, like these exact books. And I went into my into my attic and I found them like that I had colored outside of
You're
the
like,
lines.
I've already done this.
Yeah, I already did it. Yeah. I was like, I didn't need to do it again. I just loved anatomy so much from day one, and still I'm so fascinated by embryology. But that development, and then when my second brother was born, he was born with cerebral palsy and went through such a dramatic transformation, not just because of like the effort that my mom put in to get access to all of the different resources, which is part of why, like, as a physician, I'm so passionate about getting people connected with all the different resources. Like, I feel like I'm such a connector. I'm always like referring people to any community resource that I know is available if they're a good fit for it, because like, why not? Right. So my mom did that for my little brother. And now you wouldn't even know that he was born with like such a spasticity in his system, because he got access to PT and OT and all these different kinds of treatment modalities. So I thought I was going to be a neurosurgeon because I was like super fixed on the idea that like if he had gotten surgery really early on, that could have like helped, you know, like him have a different developmental path or something. And then I had this like really powerful experience on a neurosurgery rotation, like when I was going to medical school, like I was applying to medical school, that kind of showed me like, yeah, I don't think I'm supposed to do this. And I then started to like reassess things kind of after that happened. So that was after I had applied to medical school the first time. I applied quite a few times, and like the first time I applied to medical school was straight out of undergrad. And my undergrad mentorship was very like very depreciative, or like made DO seem like the diminutive path. It was like, you can be an MD, or if you don't get into an MD program, you can apply to a Caribbean program or a DO program. They like equated it to like going to an international medical school and being like an international med grad. And so I was like, oh, I don't want to have this big hurdle or whatever. So I hadn't really considered it. And then when I was in my,
which is not the case at
No.
all. Yeah.
yeah, it's
even
so
like
great.
International, Caribbean, or any of those are not even true.
No, especially now that we have like a single board that's accrediting MDs and DOs. Like there's virtually no difference. If you want to be a DO and like act like an MD, you absolutely can your whole life.
Now, have you seen, or had you seen osteopathy used for treatment of cerebral palsy?
Never, no. So I had no exposure to osteopathy until this was like such divine timing. I was like working and doing a post back and getting all this stuff together to reapply to medical school. After I didn't get in the first time, I took a lot of time to get everything together. I had to retake the MCAT because they like came out with a new MCAT. I had to work because like applying to med school is expensive. There were so many things that needed to happen. So I was working in the Bay Area, working at an addiction medicine center, I was a clinical manager at that point, just managing a medical clinic in Marin. It was really lovely. And then I was at my house, and the person who got me connected with that job, like the person was the son of the physician I was working for, he and I were very close friends. He had started at my medical school, and he ended up deciding to go a different path in life because life took him a different way. But the first day of orientation, he met my friend Mary, who you know.
Oh, yes. I love Mary.
Yeah.
Mary.
And he brought Mary over to my house, and it was her first day of orientation. She had just moved to California and just started DO school. And she and I like instantly just talked about everything. She had so much of she and I have such an overlapping life experience. Like she had been to Vipassana training. Like she and I had both done like Vipassana meditation courses, and we just had so much overlapping. It was kind of bizarre. And she was like, yeah, I love osteopathy. In fact, I didn't even apply to MD programs because of what osteopathy is. And so very slowly but surely she started talking to me about it.
Have you seen osteopathy treat cerebral palsy like in your experience so far?
Yeah, I have patients now.
Yeah.
That have cerebral palsy and are getting tremendous results from it. So it's like, I finally feel like this is the first year where I truly feel like I've come like full circle and get to sit in this seat of like, wow, like I've arrived. I feel like I've been working towards something forever and I'm here now.
So that example alone is huge because I don't know if people understand, but cerebral palsy is understood as this static disorder.
Yeah, like, oh, you get a diagnosis and you have it forever. I mean, I think that's how we talk about most disorders.
Yeah, to the muscle neurological system, but that yes, you can help it, but you can actually see some profound improvements with osteopathy because you're improving the circulation, the communication of the nervous system, and I mean, I've seen like just to comment on that, like I've seen even years later, people with cerebral palsy, so adults that they've done so great with it. But say they still have like some stiffness, you can still improve on it even many, many years later because there's so much resilience to the body. And if you help it in what it's trying to do, it can respond in such a great way.
Yeah.
Now, I know in osteopathy, which is part of the reason I want to be able to talk about this. So a lot of osteopathic professions see the bulk of what they see is musculoskeletal issues and symptoms. But I have such a different practice because we see such a broad range of things. We also address like stress, trauma, emotional trauma in a really integrated way. So we address the physical, but we also address these other components. And what I wanted to ask you is like, being here, like what is it that's like just been helped you kind of like open up, expand your perspective of what we can do in the holistic field with osteopathy, but not just even osteopathy, but in the whole holistic field in general? Like
everything. Yeah, I mean, the breadth of patients that we've seen over the past week and a half has been really incredible. Like from, older gentlemen to newborn babies and everything in between. Like, I think that just the breadth of practice that you have really shows me how much we can do. And also seeing how you treat people exactly where they are is like always so helpful to me. There's never been any narrative of like judgment. It's always working with whatever somebody else is choosing in their own medical path and just helping to make that work better for them, whether they're taking a bunch of medications or they're going like the very Western route of things, or they want to be, tended to a lot more holistically or a lot more in terms of like functional medicine and testing in those regards. You meet them where they're at and are like, okay, we're going to go this route for you then, because that's the right route for you. So that's something I'm definitely going to take back with me because
it really expands like your therapeutic toolbox.
Exactly.
It's so much to choose from.
Yeah.
They're all with like love and kindness, but there's many ways to do similar things. Were there any like aha moments with the patients that we've seen, or what you've been able to like be a part of in the practice?
We've had a lot of really big aha moments in the past few days even. Like, I think that patient that we had a couple of days ago that had the pretty severe nonverbal autism, like, the way that they just felt comfortable and, like, melted into the treatment was really not something that I could have anticipated seeing. I can't really speak to how they're gonna do long term because I'm only seeing this immediate time point right now, but just seeing how they, like, surrendered and made eye contact and were so engaged in the process and, like, so
They're feeling
appreciative.
something in the treatment, right?
Absolutely.
'Cause there's a lot of communication even without the words.
Yeah.
Yeah.
And to see, like, how much was going to happen for the family, like, you could just feel how tired everybody was and how much they needed that, and at the end, like, there was just, like, this burst of life through the whole room, even in the parents, like, they lightened up and they brightened up and they felt so much more
Uh-huh.
like, present in their bodies, so
Yeah.
that was, yeah, very profound. I'm not sure
Uh-huh.
if they would notice that, but I certainly was looking at it and sitting there kind of astonished
Yeah.
by how, like, awake and alert everybody seemed. We had one patient who was having trouble integrating some nutrients in their digestive tract, and then we saw another patient who had that corrected,
Uh-huh.
and we got to see them
Uh-huh.
when they had a similar presentation, it
Uh-huh.
sounds like a few months prior,
Uh-huh.
maybe 6 months
Uh-huh.
prior.
Yes.
So we did get to see how somebody else had transformed over time, and
How
that's
it can
something I
help with
will
like
absolutely take
growth
with me.
and development.
Yeah.
So
Like,
yeah,
just
absolutely.
nutrient assimilation, it's such a simple concept that, like, of course, the way that your gut tube is functioning and the way that your liver and your gallbladder are working with your gastrointestinal system is going to help you to be able to, like, absorb fats, for example, which is something that could help a skin condition.
That part of talking about assimilation of nutrients. So we're talking about like if you're eating a healthy diet. So well, the first step would be to have like be eating nutritious foods. But we've seen multiple people that even though they were eating nutritious foods, it's like their body still felt depleted. And it didn't really match up to like the diet that they were having. Like, why would you feel depleted when you're eating really well? So
Mhm.
either the demands are too high, or it's not still not meeting the demands, and you need to catch up. Or another thing is that you're not what we call assimilating the food well. So if it goes into your digestive tract, you need to be able to digest your food, break it down to the basic building blocks, then bring it into your circulation, and then from your circulation, deliver it to all the areas of the body that need it. So if you have some backed up plumbing or some blocks in the circulation, then you might not be bringing those nutrients to where they're needed. Or if you're starting from the digestive tract, if you are not breaking it down to building blocks and efficiently absorbing it into your circulation, then it might be just going right through you, which can happen easily to more people than you would necessarily think about. So but to improve that, it's such efficiency. Like I talk about this engineering approach to treating, because if you're eating healthy but not getting everything that you can out of the food you're eating, then the process is inefficient.
Mhm.
So if you could somehow improve that digestive process and that delivery system of the nutrients, then instead of working really uphill by like increasing doses of things that you're taking, whether medications, even herbs and supplements, you're having to like pound it really hard because all the plumbing and digestion is not working as
Mhm.
efficiently. Like that's a lot of like upstream work to me. So going with the ease would be like, well, let's just optimize what your
Yeah.
body can do on its own.
Right.
So you won't have to, it won't feel as hard. And so this like that integration of this osteopathic approach with a holistic perspective of what you were doing to like addressing the diet, how you think about it.
I mean, just to cycle back really quickly about the other patient, like that patient that we saw was simply just not assimilating nutrients in the sense that like there was still like at the end of their whole digestive tract, there was still like fully formed food. So they just like weren't breaking it down. So even just seeing the difference, like in the span of a week of how they've been able to change in their own body and start to gain weight and start to assimilate those nutrients just through one osteopathic treatment really shows me, like, it takes me out of that limited perspective of like, I'm just going to align this, and this, and think much more about how, like, in the span of a single treatment, you can truly change the trajectory of somebody's entire life.
That's like incredible.
Yeah.
Incredible.
It's incredible.
And then to bring the understanding to it. So we have like the feeling understanding and that physiology, but then, and then we have this cognitive understanding of like, oh, what would interfere with the digestion, and then to be able to address that. So for some of these patients, they weren't able to gain weight, but then for another person who has assimilation problems, it could be that they're actually gaining too much weight, and they're still not dealing with the nutrients
because it's not in balance, right?
Yeah, but I do love something that you said about just that rhythm and the cycle of things, and thinking about the tides, and if we're talking about women, like monthly cycles, and how your needs might vary depending on where you are in that rhythm, that cycle, and that how you might need to eat slightly differently.
Yeah. Oh my gosh, it's not even. I mean, I think as somebody who lives in a female body who menstruates, like, I was on so many hormones for so long that I didn't really have a concept of a cycle until pretty recently. And once I finally got off all that stuff and cleared all the medical intervention out of my life and became empowered of like, this is something that we have ancestral wisdom around, and we can like regulate using other modalities. Like, one of my favorite books that I talk to patients about, especially if they're in the phase of life where they're considering getting pregnant and thinking about moving off of birth control, I tell them to read Taking Charge of Your Fertility. It's such a good book. It's so empowering. But that's like the first time that I really started to understand the concept of cycles, was when I got to have the experience in my own body. I wasn't like on some IUD or something. And I think that after I had that experience of like a 28 or 29-day cycle, I started to be able to project longer, because something that I noticed, which is, you may perhaps try to observe this if it feels safe in the state that you live in, to like track your cycles on an app, or you can track them manually. That book that I just told you about, Taking Charge of Your Fertility, has a manual chart in it. If you're afraid of like somebody having your data, I totally respect that. But starting to look at your cycles over the course of a year, 2 years, and taking notes and seeing what the trends are long term shows you that there are bigger cycles than just that little one that's happening. Like, everything is happening in a harmonic. So one of the things I started to realize is that like my cycles were switching between the new moon and the full moon over the course of a year in this gorgeous like infinity symbol. Like, it was like, okay, now we're going into this one, now we're going into this one, and where you align to, and mapping the alignment of how those cycles play in with the lunar cycles, how they play in with the seasons, and how we transition during times of rest to be in alignment with like maybe having a cycle at the new moon versus during times of abundance to having a cycle with the full moon is amazing to start to witness. And once you see those bigger cycles, you start to realize that there are timelines that are far greater than you can even understand, like time cycles that are far greater than we can understand.
Fascinating, huh?
It's amazing.
Yeah, we're going to continue this conversation.
Like, that's just a year.
Women's health and everything. So, as you feel like you're more and more connected and more in tune with your body, like, how would you describe that feeling? Like, what is that difference to you?
Oh my gosh, great question. I mean, for me personally, like, I have such a sensing job, but when I think about how I explain it to other people, like my patients, the first things that I start to ask them are similar questions to what you have in your book, actually. Things like, what is something that used to bring you joy when you were a kid? What are ways that you are able to incorporate play? Because play often leads us to ritual. And ritual is something that we've had that gives us a connection to our ancestry, that gives us connection to like all other humans that have come before us, and gives us connection to the people that are around us right now. And those can be such gateways and portals to healing that I find them to be like really profound in terms of accessing cycles, starting to witness when we maybe feel one way versus another way, so that we can listen to the wisdom of our bodies rather than thinking that we need to perform the same way every single day. Like, this is such a masculine structure of approaching, because like the male hormonal structure of testosterone is very linked to the signaling of cortisol, and those peaks come in the morning, just like how cortisol will ramp up in the morning right before we get up. That's actually what's supposed to wake us up in the morning if it's well regulated. So that 24-hour cycle is designed by men for men, but like women are not supposed to perform at the same clip every single week of the month, and certainly not supposed, and this is not just true for people who ovulate and menstruate. Like, I truly believe that people who have an anchoring in their divine feminine, regardless of the body that you're in or the sex that you were assigned at birth, and like the gender you were assigned at birth, you can have a predominance of masculine versus feminine energy that you need to work with.
Well, it's part of everyone. It's part of
Yeah.
like understanding just the energy, the meridians, and when we're talking about masculine, feminine in that way,
Right.
it's not gender.
It's not about gender.
It's about energy. And you think about like in nature, the sun and the moon and the tides, and how much the tides are controlled by literally the phase of the moon, and how it's absolutely incredible.
I'm so glad you talked about the sun and the moon, because those are the archetypes for the divine masculine and the divine feminine. And what rises every day? The divine masculine, the sun. And what has a 28, 29-day cycle? The divine feminine, the moon. Like,
so it's like
it's all in our, it's embedded.
It's understanding these terms in a different way than maybe like we're used to in regular language. So it's more like that yin and the yang, and how it's all supposed to work together. And then day is supposed to flow into night, and the night is supposed to flow into day again. And so these rhythms are actually a natural part of everyone. And it's not gender specific, but there's gender nuances. And if you do have a cycle, there will be nuances. And you can see, like, you look at the ocean and how many different rhythms there are in the ocean, how many different waves there are. So you can think about people like that. There's so many different rhythms, and there's not like a right or wrong wave, a right or wrong rhythm. Some will be more intense than others when you get a tidal wave, and that could be situational or depend on that moment in time. But the ocean is beautiful no matter what. And so we are too.
Yeah.
I
couldn't have said it better myself. It's like one of my favorite things to go look at. And whenever I need to be reminded of the tide, in fact, there was an OCA course where they said once that they used to hold OCA retreats like by the seashore, and all of the osteopaths would like feel the tide shifting, and they would see if they could find that like still point between when the tide was going in and the tide was going out.
That's
beautiful.
A traditional osteopathic experience of being able to sense. And I mean, it's a big pull if it can move large bodies of water like the ocean. So yes, you can absolutely learn to feel it. So if you are by the coast or going by the coast, it might be a fun thing to do if you find a tide chart and see when that changes, to just be present with it and see, can you feel that pull of the water? And since we're mostly water, then part of you will have that pull within you. It's just that we're not really thinking about it. But if you just brought your awareness to it, just like what time the tide changes, then you could feel that little tide change within yourself too.
I'm always thinking about myself as water. I grew up in Southern California by the beach. I went into the ocean every single day of my life. And so like I'm very much a water oriented person. But
Heidi is beaming Southern California.
So I feel like, of course, like everyone doesn't feel in this way. And then you get into osteopathic school and they're like, do you feel the bones? And I'm like, no. I had to like work really hard to feel bones and to be able to like articulate them, because it was so antithetical to my sensing. My sensing is so fluid based. Like cranial was like great for me.
Yeah, like in teaching different kinds of people and different constitutions, like I can say that it's also just understanding like who you're talking to and what their constitution is. So this is helpful whether in a teaching situation or with a doctor-patient situation or in a family situation, any relationship, that if you can understand someone's constitution, if you speak in that language, then it's so much easier to learn.
Yeah.
Because it's not that the bones, of course, are not totally dry. They have fluid moving through them. They have arteries and they need nutrients and they're always turning over. So they actually have a rhythm and they actually have a fluidity to them.
Yeah.
And if the bone is alive, it has that like rhythm of aliveness to it, that vibrancy. So if you since you have a lot of water, if you start to look at that things in that way. But I think about other people, maybe they have more earth, in them. And so like mountain people, if we start talking about things like too fluid, then they actually feel like less grounded and steady, and they need to be able to feel the earth. And so those kinds of people actually might feel better to start expanding the perception with like really earthy things, like being able to feel bone, but then building from there. Because if you're standing on a mountain, you can appreciate the sun and the wind and the trees growing on the mountain, and then the streams on the mountain. So talking about things in that kind of language, like for one person, it was like bringing in a mountain lake, a crater lake. So then you can, an earth person could get in touch with fluid and water by being able to like think of it in terms of like a crater lake, because it's surrounded by mountain beauty. So it's like it's just lovely. Switching up the language, and that's what I love like in my practice too, is that we can use the language that anyone's comfortable with. So we can talk anatomy and physiology, and we're well versed in that in osteopathy, although it's infinite in terms of understanding. We can talk about energy and energy centers. We can talk about masculine energy, feminine energy in that non-gender way. And we can talk about like mindset and intention and emotions.
Yeah, I mean, I think that that's one of the truly the greatest privileges of my entire career, is that I get to spend my whole life forming and creating bridges and meeting people exactly where they're at and just saying, how can I help you? And that's the question that I'm always asking the body. When my hands are on the body and I don't know where to go, I just say, show me, lead me where you need me, show me where I can help you. How can I be of assistance? And that opens up so many gateways and portals for somebody else to start to claim the empowered ownership. Even Dr. McGeary talks about that in her book. This is an incredible book. I just picked it up for the first time this week because as Dr. Diamco gave it to me to read this week, luckily. And oh my God, like she really practices like an osteopath, but she practices holistically, right? There's so many different words that we can put on this way of practicing, but truly it comes down to a recognition of the wholeness. The fact that we are so much more than just a physical body that is just a series of biochemical reactions and gates that are opening and closing. Like it's so much more than that. We are a spirit. We have life. We have vitality, and we are connected to an infinite source of that vitality. And because of that, we are so capable of self-healing, and everything truly is interconnected, which are the osteopathic principles. That's why she knows them so well, because her parents were osteopaths.
Dr. Gladys McGeary is such a beautiful soul. She recently transitioned at almost 104 years old. And her philosophy and approach to health and healing are so aligned with mine, with the osteopathic profession, with a lot of holistic approaches in general. And there's such a focus on the soul's journey. And that's not meant to be like tied to any particular religion. What it means to me is that you are important, and your journey is important. It's important to you, but it's also important to everyone else. And that's that interconnectedness that we have, that each of our soul's journeys is important, and it's part of our health and vitality. And so if we can remember that and realize that, then we can access greater healing. And for people that aren't aware, Dr. Gladys McGarry has a foundation called the Foundation for Living Medicine. So full disclosure, I am on the board for that foundation, which is such an honor, such a beautiful group to work with. And in September, we're going to have a conference called the Eagles Gathering, which we'll be unpacking many of these concepts as well. And it's just a 2-day conference. It's geared for physicians, naturopaths, osteopaths, but we are actually welcoming anyone that would like to register would be welcome to attend.
Wow.
So
that sounds like an incredible opportunity.
Well, thank you, Heidi.
Amazing.
It's so fun. We could talk here for just hours, days.
Yeah, we talked for at least an hour before we even pressed record on this thing, and we were like, we should just start recording.
Yeah. Is there anything else that you'd like to say before we sign off here?
I guess one of my final thoughts that I'm really sitting with a lot this week and integrating is, regardless of what anybody else tells you, you always have a choice in the way that you are going to be able to heal and the path that you can move forward. And that sovereignty and that autonomy is your divine birthright. Do not ever let anybody take that from you. If somebody tells you because you have an accident that you're never going to walk again, you can walk again. Literally, if you go read this book, she has a story of a patient who had such severe injuries and was in a full body cast, told that they would be never able to walk again, and they did. Miraculous things happen all of the time. And it's not just osteopathy. Whatever tradition you come from, there are so many stories of miracles, and they're not getting put out on the news because they're happening to regular people. And so just remember that this is possible for you, and there is always a path forward, regardless of what you've been told. Nothing has to be forever. You can always change the outcome of something. And as long as you are living and breathing, there is a vital, potent life that is moving through you. And there is love and joy to be found in that.
Yeah, there is. We have so much resilience. We don't always know the depth of why we experience something or why anyone in our lives experiences something, but to focus on like your life is meaningful no matter what. And to echo what Heidi was saying, I love what Dr. Bernie Siegel, who has done so much work in terms of the art of healing, he says, don't be a good patient, be a responsible patient. And so that's exactly what Heidi was talking about too, is that you need to feel empowered with your decisions, and you need to feel good about the choices that you're making, especially when it comes to your health and the health of your family. So to be able to collaborate with whoever you're working with, and to make decisions that feel good to you. And if you have questions, to ask them. And if you want to like look for other ways to approach things, to ask for them, and to ask for that guidance if you're not sure where to look. And that's what Heidi was talking about, like we meet the patients where they are, because there's so many details and aspects of health, and pushing someone to do something that doesn't feel good to them ultimately is not the highest healing. And so we need to like come together. It's not, if we disagree on approaches, it doesn't need to be out of anger. We're allowed to disagree, and we're allowed to have different approaches. But as long as we're coming out from love and kindness, and with a sincere intention to approach it for the good of all, to approach it for, the health of our patients, and not coming from this ego of just trying to be right, then you'll be able to open more doorways and more pathways for greater healing.
Yeah.
So
beautiful.
Thanks, Heidi.
Thank you. This is great.
We covered a lot of ground there, but just a sneak peek. At some point, we will circle back around. This has been a hot topic, women's health. and perimenopause, moving the
Mhm.
menopause, or the stages in a woman's life with that cycle.
Yeah.
We will come back around to that. There's been a huge request, and so
Mhm.
we have some behind the scenes work that we're doing, and we're going to have a great group together to talk about just that from
Amazing.
many different perspectives. You can have a more full understanding. So thank you, Heidi. It's been a joy to have you witness these miracles every
Yeah.
day with me.
Yeah, it's truly a
And they
blessing.
don't always unfold exactly how you want them to, but every moment itself is a miracle, because just being here is a miracle.
Yeah. Couldn't have said that better myself.
Lots of love to all of you. If you would like to connect with me in other ways, you can on Instagram at All Worlds Health, Facebook, All Worlds Health and Pediatrics. You can sign up for my e-love letter. I send it out about once a week on Wednesdays, and that's on allworldshealth.com. Remember, I believe in you, so I hope that you believe in you too. And I'll see you next time on another Wednesday for an episode of the MultiDimensional MD. Take care.